Mr. Figures is recognized for 5 minutes.
Thank you, Chairman Johnson, and thank you, Ranking Member Davis. And thank you to all the panelists for being here today and sharing your wealth of knowledge and experience in this industry. And I join my colleague, Congressman Mann, and others here in acknowledging the duty, the obligation that we have to preserve and invest in our rural communities. I represent the 2nd Congressional District of Alabama, where 11 of the 13 counties that I represent are completely rural, and large portions of the 2 remaining counties are also rural. I think, America has to understand the role that rural America has played in making us who we are. I like to say in Alabama that the big cities of Mobile and Montgomery and Birmingham and Huntsville, they have literally pulled almost every resource imaginable from the rural communities to feed themselves, to employ those communities, to provide the wood that makes the furniture around here, and the people. That's part of the economy that we live in. But we can't turn our backs on those communities. We have to recognize that they have been there providing for us for so long that we have an obligation to provide for them as well. And unfortunately, we see, particularly in my district, we're seeing a lot of struggles for our rural communities. We are seeing not only people leaving and not returning home, people growing up there and having to leave for employment opportunities and education opportunities. We're seeing our rural communities even still struggle with some very primitive sounding issues. I mean, I have places in my district where they can't have access to public sewer systems yet. The soil concentration is not conducive to septic tanks. And so what they do is literally do what they call straight piping sewage right out into the woods. That sounds like a third world issue. That sounds like something that's an extreme thing to say, but it is something, if you Google, you will see it's something that we still struggle with in certain parts of Alabama. We have grocery store deserts where we have rural communities that literally are miles away from grocery stores, and sadly, our health care system, particularly in our rural communities, is the worst in the country. And what I mean by that is we have had several hospitals that have closed within the past few years. We have a handful more in my district that are literally month to month. They have to go find money every single month from a county commission or a city council just to be able to make payroll for a hospital. And after water and electricity, I think a hospital is the 3rd most important piece of infrastructure you can have, because no one wants to live, no one wants to retire to, no one wants to build or develop in a community when that conversation begins with the reality that we do not have a hospital, right? Something that basic. And so I take the obligation to support our rural communities incredibly seriously. And as a father, I think a lot about how where a child grows up shapes the opportunities that they'll have. And in rural America, especially Alabama, family face barriers, some of which that I've mentioned, that have nothing to do with hard work or talent, but simply geography and the lack of investment. And so with my time remaining, I'd like to just pose a quick question related on the healthcare side of things. We know rural hospitals are closing, and keeping doctors and nurses in these communities is becoming increasingly difficult. But from your perspective, how critical is USDA's investments in community facilities and healthcare? How critical have those investments been for maintaining access to care and for encouraging providers to stay in rural areas? And how critical is it that we continue to make those investments? Ms. Brand?
Certainly. The community facilities program for publicly owned hospitals, and actually for privately owned hospitals, the B&I program can also provide guarantees, but it is absolutely critical. I can't tell you how many opportunities, and I'm sure Ms. Small also saw those on her visits, about the difference a community, it made to a community to have that hospital supported by this community facilities program. There was a hospital that I visited, I believe it was in South Dakota, that they simply, they had no patients. They were willing to drive because they perceived this hospital was not modernized, that they couldn't get the decent health care. They built a new facade, they added some equipment, and all of a sudden people realized this is a good one. And so it's not just the hospitals, it's the quality of doctors, it's the modernization of equipment that has to, it all comes in hand. And you're right.
And I'm sorry, I don't mean to cut you off, but as my time is closing, I'll just leave with this statistic. We have 52 rural hospitals remaining in the state of Alabama. 26 of them are rated as being at risk of closure, and of those 26, 22 are rated at being at immediate risk of closure. So these investments are critical to providing that sort of access to healthcare in our rural communities. Thank you guys so much. I yield back.